If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. Welcome back to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Massachusetts. I have a really exciting topic to talk to you about today. I'm going to talk about cancer and its reliance on blood and blood vessels. So that's today's topic. Cancer cells can live without oxygen and without blood vessels for a little while, but they can't expand. They can't really get very numerous. They can get to about 1 to 2 millimeters, and then they start needing more nutrients and blood and oxygen. And so before I start talking about the mechanisms of how cancer starts to form blood vessels, I want to give you a little analogy to start thinking about it. This will help it make it clear, because there's kind of a lot of science involved with how blood vessels are formed in tumors. So let's think of a couple that are born out in the woods, away from civilization. So they're out in the woods. There's really no roads or supermarkets or any of that stuff. And they want to start to have a family. So they start having babies. And initially this is fine because there's food in the woods nearby to help feed their growing family. So these are like the cancer cells out there all by themselves. But as the family starts to expand and grows, and there's more mouths to feed, they run out of food in the vicinity where they are. So some of the family members start to spread out, and they spread out along some of the existing paths that are there. Not paved roads, but just little paths. And they start to gather more food for themselves and all their family members. And this works for a period of time, but as that family gets bigger and bigger, there's not enough food along these existing pathways. So they have to widen the roads and go out looking for more food elsewhere. So they start to cut down some trees, and they might, the other family members are all helping out, and they start cutting down trees so they can build these bigger paths, and they send out signals to the outside world. So maybe there's cell phone coverage or something, and so they start calling on the phone to get some help. They've met some people in the outside world, or they send carrier pigeon or some calls or some messages to get some help in building roads to connect their area to the outside world. And so their population can now expand. But as the roads are built and their demands become so large, and the delivery trucks are coming now with food to feed their expanding family, maybe after a while those roads that have been built are not big enough or numerous enough. And so they widen them and make them bigger and make even more roads. And now they can expand even more. And then after a while, there's different family now within the big family, and some of those decide that they want to move away from that one area. And so they travel down one of those roads and go somewhere else distantly, and then the whole process starts over again. So think of that analogy. So now let's put this into the context of cancer. So first of all, cancer cells are born in a particular area because of some kind of mutation that occurs in the DNA. So it could, a mutation happening in a duct cell of the breast or in the prostate or anywhere in the body. And the mutation of the DNA is what causes the cancer cell to form. So we all know, like cigarette smokes, carcinogens in cigarette smoke cause DNA damage in lung cells or other cells. Bladder cancer, pancreatic cancer is all connected with cigarette smoking. And it takes years, but that mutated DNA then eventually leads to cancer cells, and a population of cells is born, just like that family is born out in the woods all by itself. Other things can cause cancerous cells to form, radon in the basement, benzene exposure, chronic inflammation from acid reflux to viral hepatitis to inflammatory bowel disease, viruses. Numerous things could cause damage to the DNA of a cell, eventually leading to the birth of a cancer cell. And then that cancer cell then replicates and creates its own little family of clones. And that clone can then grow up to about 1 to 2 millimeters without the need for any blood vessels. And they're just getting nutrients from surrounding cells and fluid that surrounds the cells, and that's how they get it. Just like that initially that small family can start to expand in the woods just using natural resources in the woods. But after they start to grow too much, they need to go start spreading out. And so if after the cancer cells get too numerous, they need more nutrients, and they need it from the blood. And so they might initially start to hijack existing blood vessels. It's like I mentioned that some of the family members can start going down these paths, and they start to expand out from the home base area, going down existing paths that are already there and looking for food sources along these paths. So cancer cells start to migrate along existing blood vessels because that's where all the nutrients is, that's where all the resources are for them to eventually expand. But then they, gets to not enough for them, and they need to get more numerous. Just like after a while, those paths, you've pretty much used up all the nutrients at those paths, and now you need some help. So now you got to start calling into the outside world for some deliveries to be made, and because the cancer cells need more nutrients, so they start to release signals. And they asking for help now. And so you could think about it, these people out in the woods needing some help, and I mentioned sending a text, a cell phone message, send out a carrier pigeon or something. They send all these signals out in different ways to ask for some help. And then all of a sudden these cells start to come in. So you think of contractors and just people, that are going to help build the roads for them and help them get their nutrients that they need. And so these cells come in, and they include inflammatory cells called mast cells, neutrophils, which I've talked about in previous shows, macrophages, M2 macrophages. And these cells help cut down the trees, we say, help cut down whatever's in the way so the blood vessels can start to grow into the tumor and expand those existing paths. So there's more room and nutrients for the cancer cells to get, so allowing those delivery trucks to come in. And then sometimes, initially, until the roads are officially built, cancer cells may actually even make their own tubes out of cancer cells. So they create like a temporary structure where they're connecting themselves to an existing blood vessel by lining themselves with more cancer cells. So the cancer cells themselves make a hollow tube that allows nutrients and stuff to go. But then after a while, though, these growth factors, these messages that they're sending out get heard, and the blood vessels that are nearby start to sprout. The nearby roads start to connect to the actual mass of growing cells. And that's called sprouting angiogenesis. And then when those blood vessels are not enough to supply it, like I said before, that the delivery trucks are not able to, there's like traffic jams, they're just not getting, because the roads are so narrow and everything, and there's not as many, and the cancer cells need more nutrients, they start to widen the roads and make them more numerous. And so what happens is existing blood vessels that are there start to pinch in half, and then one blood vessel becomes two blood vessels, and that can take a matter of minutes to hours, not that long at all. And that's how cancer cells more rapidly get the nutrients that they need and the oxygen to start expanding more. And then, if after a while they want to leave that home base, then now they have the roads already established. They just hop into the blood vessel or a lymph vessel, and off they go to to start the whole process over again, just like I mentioned. Once the family it gets big, certain groups of the family might decide to go off, and the same process happens somewhere else. All right, so that is to give you a better understanding of how blood vessels form in tumors and all the different ways that happens. There are a few FDA-approved drugs that inhibit blood vessels that have been approved, but they're really only scratching the surface right now. There are so many ways that cancer cells can make those blood vessels, and the drugs only affect a few of the pathways, and that's why they don't work that great, and more research needs to be dedicated on this. But there's some natural things I'm going to talk about that can deal with a whole bunch of other pathways and processes that the cancer uses to form those blood vessels. But first, let's talk about the FDA-approved drugs. The main one is called Avastin, and Avastin is a drug that binds to a particular growth factor that stimulates blood vessel growth, a very important growth factor called VEGF, and it binds to it. And so it basically takes that signaling away so the cancer can't use it as much to help make blood vessels. So it's like that cell phone signal that goes out from that home base calling for help, saying, please come in and make some roads. I need more nutrients. So that's what this VEGF thing is one of the many signaling systems. And the Avastin binds it and keeps that from doing its job. And it's been approved for metastatic colon cancer and brain cancers, glioblastoma and kidney cancers and things like that. And they've done some studies and where they add this Avastin to the current chemotherapy program for colon cancer, for example. And it basically, the median survival is like 1.4 months longer with the Avastin. So it doesn't add much more to the existing survival, unfortunately. And why? Because there's all kinds of other blood vessel growth factors. So you block one thing, and in the one signaling system, and the cancer just upregulates a bunch of other signaling systems. Just like, okay, I take away your cell phone, well, you send out a smoke signal, or you send out a carrier pigeon, or you send some other message out, a fax if you have it, and get that message across saying, I need some nutrients, I need some deliveries here. And that's what the cancer cell does. So you have to, in essence, block all of these different signaling systems. Glioblastoma, the brain tumor, Avastin is also used. And the overall survival was about the same when Avastin, but the cancer didn't progress as rapidly. It slowed it down by a few months, but end-up survival was the same. And Avastin does have side effects. It can cause bleeding and clotting, and so it definitely needs to be improvements. And there's been some other drugs that have been approved, like one called sorafenib, and it's used for kidney cancer or liver cancer. And it affects more growth factors than just the VEGF. It affects another growth factor called PDGF and VEGF. So it's trying to affect two things instead of just one, like the Avastin. But even that, you'll hear in a minute here that there's even more than just two growth factors that are involved with blood vessels. Sorafenib only affects the two main ones, the VEGF and the PDGF, platelet-derived growth factor. And they've used it for liver cancer that can't be removed surgically, but it basically adds like 2 months to the median overall survival. So that is, it's a start, but there needs to be a combination, almost like a cocktail, like they use for HIV, to inhibit all the different growth factors involved. But there's more toxicities. Sorafenib can cause rashes and stuff in people, raise liver enzymes. So natural medicines would be something to look more into, because there's a whole host of animal studies, which I'm going to get into, talk about these natural things from pomegranate to green tea, like a lot of food-based things that have blood vessel inhibiting factors that are often a lot better tolerated and might be able to affect more of a widespread signaling system. There's another drug called sunitinib that also affects the PDGF growth factor, the platelet-derived growth factor, the VEGF vascular growth factor, and something called c-KIT. And it's also been shown to be helpful, but only not too much, compared to other treatments, but a good start. But it causes diarrhea and affects the liver and stuff like that. So there are drugs out there, not too many, mainly kidney cancer, brain tumors, colon cancer, but blood vessel inhibitors are not as widely spread used right now because of their shortfalls and not being able to affect survival as good as was originally hoped. And that's because they're finding out it's a lot more complicated. So why don't these new blood vessel drugs work for a long period of time, and how do tumors become resistant? Well, there's about 4 different known mechanisms of how cancer cells become resistant to a lot of these blood vessel inhibiting cells and how they form these blood vessels. So first thing is, so in comes Avastin, using it for, say, colon cancer or the brain tumors, and it blocks one of those growth factors, the VEGF I mentioned. And so what does the cancer do? It activates other blood vessel producing pathways like PDGF, and I'm going to get into it. There's a whole bunch of other ones. Or it upregulates the pathway that is being blocked. So you inhibit VEGF, then it increases that even more, the production of VEGF even more, to try to dilute out, should we say, the Avastin. So if I'm doing something to interfere with your cell phone signaling, then you might keep making tons and tons of phone calls or using somebody else's phone. So you're still doing a phone call, so you're still releasing VEGF, but you're really releasing a lot of it to try to overcome the blockage. Or you say, okay, forget the cell phone. I'm going to contact you via fax, via text, via carrier pigeon, whatever you want to get the message across. And that's what happens. Another thing is that the cancer cells will release these chemical signals that cause the bone marrow to start releasing precursor cells that turn into blood vessel walls. So if you're taking away the supplies that the cancer has nearby to make blood vessels, then it will recruit blood vessel progenitor or precursor cells from distant places, the bone marrow that is, and have them migrate into the area and then start forming the blood vessels. So if I took away the wood and or the gravel or whatever you're going to make this road out of in your area, whatever resources you have, well, then signals are sent out saying, hey, you down the street, can you bring in some materials to make the road because, somebody's interfering with, me making my road right here and taking away all my supplies. And so the cancer cells release these growth factors that cause the bone marrow, which is a source of immature cells that can turn into other cells. The bone marrow releases these blood vessel producing cells. Another thing is the drugs like the Avastin and the sunitinib and the sorafenib drugs cause the blood vessels to start to kind of wither for a temporary period of time. So it's taken away the growth factors. So it's like taking away the group that maintains the road. So the roads start getting full of potholes and start to break down. And you need a construction crew that comes by every once in a while and fixes that. And so what happens is the cancer cells start to recruit what's called periocytes that are reinforcers to the roads or the blood vessels to make them more sturdy and stronger. It's like the roads, the gravel roads are starting to break down, so somebody comes in and paves them, makes them more sturdy and better because the drugs are interfering with the development of the road. So that's another thing that they'll do is they'll make these periocytes, they're called. They're just reinforcers to the blood vessels to help strengthen the ones that are still present after being kind of withered from the drugs that are blocking the growth factors. And then the last thing is that the cancer will say, okay, you're taking away my signaling systems that are needed to make my roads. I'll just use those existing roads that are there, and I'll just spread out. And that's the real problem, is then the cancer goes from a localized site and now it starts to spread out all over and metastasizes, just because if it starts bleeding outward, it can find the nutrients that it needs other places. And so you need to do things to stop those invasive processes from happening from some of these blood vessel inhibiting drugs. Okay, so I'm going to take a break, and then I'm going to expand on each of these 4 points and how natural medicines can play a role in affecting each one of these processes. This is Cancer Concepts and Compliments. I'm Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from Lexington Natural Health Center. Before the break, I was talking about 4 different processes of how cancer cells become resistant to the current anti-angiogenesis drugs, the drugs that are blocking growth factors that are needed to make blood vessels. So let's start with one of the first mechanisms is that if a drug like Avastin or sorafenib or sunitinib and the different ones that are out there are given to a patient, the cancer cells may then eventually start to produce other growth factor signals that are not affected by those drugs as a method to help continue their quest for making more blood vessels and getting more nutrients. And I give you the analogy that if somebody takes away your phone and you can't communicate that way, well, then you send a fax. Or if you're out in the woods, you send out a carrier pigeon or a smoke signal or something to ask for help and get somebody to come by with deliveries for your food to keep your growing family happy. So I'm going to give you a list, and this is what's known so far of all the different things that are made by cancer cells and cells that surround the cancer and helper cells like in those inflammatory cells, mast cells, neutrophils. There's a lot of cells that are contributing to helping the blood vessels form. So there's this VEGF, vascular growth factor. But there is at least there's 5 types of VEGF, and then there's something else related to VEGF called PGF, placenta growth factor, and there's 2 of those. So again, even if you just block one, there's numerous other VEGFs that play a role. Then there's something called FGF, fibroblastic growth factor, GF standing for growth factor. There's 18 different ones of those known. Then there's PDGF, platelet-derived growth factor, and there's at least 5 members of that. There's TGF, transforming growth factor, and there's at least 3 of those. There's something called angiopoietin, and there's 2 different ones. There's something called ephrin, MMPs, and there's numerous MMPs. Then there's these things called chemokines, like something called interleukin-8 and SDF1. There's osteopontin. So you're getting the picture there that there are numerous signaling systems that cancer has in place or the body has in place to make the blood vessels that it needs. And blocking just one pathway is not enough, and that's why the overall survival isn't improved that much by a lot of these drugs. But let's talk about some natural medicines that can affect that. But first, so Avastin, for example, there's been studies, you give a patient with a brain tumor Avastin, and the VEGF decreases or is blocked, and the blood vessels that are in the brain tumor starts to wither and narrow and shrink a bit. But then there's an upregulation, for example, in FGF, fibroblastic growth factor. And then if you give something to block the fibroblastic growth factor, then it restores the sensitivity to the Avastin. So it makes the Avastin continue to work. So Avastin's taken away a necessary thing, the VEGF. So we've taken away that cell phone. You don't want to give the cell phone back to the people. You want to keep that away, but you also want to stop the faxing and the texting and the carrier pigeon and all methods that are needed. And so, for example, so you can measure FGF. You can measure a lot of these growth factors and see which ones are really playing a role. That's what is really helpful is the lab can be a really good guide to help determine of all those growth factors I just listed, which ones are involved in the person's cancer at that present time. And then you can keep checking them to see what has changed, especially when a blood vessel growth inhibiting drug is used. You want to check VEGF, make sure it goes down if it was elevated in the blood, and then you want to make sure that these other signaling systems aren't starting to upregulate. So you can check FGF, for example, in the blood. You can check PDGF and TGF and interleukin-8 and all these other growth factors. And there's numerous studies showing that if they're elevated, well, that is associated with a worse prognosis because it's a growth factor that's needed to form blood vessels. And then if you take these things away, that can be useful. But right now, there aren't a lot of approved drugs that take away a bunch of all these other growth factors. But there are natural medicines that at least there's animal studies and some human studies showing that they can reduce some of these growth factors. Where I like to see is a research study where they've used them all together and then using the lab to help construct a treatment plan. So you do a panel on a person that has cancer, checking all the blood vessel growth factors, as many as you can check, see which ones are elevated, and then put them on specific either medicines or natural compounds that take away those growth factors, starving the cancer of those things, and then keep an eye on them, making sure nothing changes, because cancer has a history of evolving and changing, and this way you can stay ahead of it. So you can measure FGF, and if it's elevated, there are a couple natural things studied in animals that can successfully reduce FGF production and inhibit blood vessel growth. And one of them is cordyceps, which is a mushroom that grows on the head of a worm, or a caterpillar, I mean. It's called cordyceps, and that has been studied. And then there's something called Gleditsia, a Chinese honey locust. It has these pods, like these fruits, and the pods or the fruit extracts have been studied in animals where they give it to them orally, measure FGF, and it reduces the production of FGF and inhibits blood vessels and helps shrink tumors and stuff in animals. So more research needs to be done on that. I mentioned last week when it comes to prostate cancer that FGF is not always the best marker to measure that. It might not be elevated, but still playing a role. So another thing that you can measure that it can be related to the FGF growth factor system is something called fibrinogen. So cancer cells can generate fibrinogen, or the cells that surround the cancer can make this compound called fibrinogen and fibrin. And fibrinogen and fibrin are like a magnet or a binder for FGF. So if FGF is floating around in the vicinity, the fibrinogen grabs it and brings it in. Just like if there are people around this family of cells there that can help make blood vessels, that they grab them and say, "Hey, come over here, help me make it." They pull them out and put them to work. So fibrinogen could take normal amounts of FGF and allow it to bind to the cancer in the blood vessel cell walls, so that they can start to make blood vessels more. So there's numerous studies showing that fibrinogen, if it's elevated, or fibrin in the blood, that it can contribute to blood vessel growth through the FGF system. So you measure that, and there's all kinds of therapies that can lower that, natural therapies. So you measure fibrinogen and fibrin products in the blood if they're elevated. I mentioned there's one compound from frankincense called boswellia that has been studied in animals, and there are a few human studies done in brain tumors showing that boswellia might play a role in helping with brain tumors by helping to prevent FGF and blood vessel growth. It doesn't affect every blood vessel growth factor, but it plays a part in affecting at least the FGF system. And so you can measure fibrinogen, see if it declines with boswellia. But there's numerous other things like curcumin, for example, from turmeric, can also affect the fibrinogen system. Another thing that upregulates the FGF system is something I've talked about numerous times called PGE2. All cancer cells are lined with fat, and the fat comes from whatever you eat. If you're eating all kinds of saturated fat and what's called omega-6 fat from grain-fed dairy products and grain-fed meats, the cancer can start to produce an elevated level of something called PGE2, prostaglandin E2, and that also increases the activation of FGF receptors. And then if those become more activated, then it can utilize smaller amounts of FGF to make more blood vessels that way. And so numerous things I've talked about before can reduce the production of that PGE2, from getting rid of the omega-6s from your diet or reducing them, taking out the grain-fed meats, taking out the vegetable oils and the grain-fed dairy products, and start increasing your intake of omega-3 fatty acids from flax seeds, from fatty fish, from chia seeds, from grass-fed meats, pasture-raised eggs and chickens, and getting your omega-3s that way. Then vitamin D is also really important when it comes to PGE2. Measuring vitamin D, there's a lot of people that are deficient in vitamin D out there because we're not getting enough sun. And if you don't eat fatty fish, it's really hard to get vitamin D also. And vitamin D is an inhibitor of this PGE2. And that's why it's been connected with, a deficiency of vitamin D has been connected with increased rates of all kinds of cancers. Well, vitamin D has been shown to downregulate the FGF system by decreasing PGE2. So it's a simple thing to have tested in the blood, see if you're deficient in D, and supplementing or getting more sun or eating fatty fish or whatever you want to increase your vitamin D levels. And curcumin also has been studied in humans, in women with breast cancer, showing that curcumin can reduce the production of PGE2. And I mentioned curcumin, which is from turmeric, the Indian spice, has also been shown to reduce FGF. So these are some natural things that might prevent the FGF system from upregulating, especially in response to some of the Avastin-like drugs. And especially if somebody that has high fibrinogen or high FGF in the blood or even elevated levels of PGE2 in the urine. You can measure all that stuff. There's another growth factor. So there's another drug, sunitinib, for example, that when that stops working, another blood vessel growth factor tends to go up. And they've done studies showing that there's this other blood vessel growth factor called osteopontin that will increase in the blood and help cancer cells make those blood vessels that they need after being affected by sorafenib and sunitinib drugs. And so you can measure osteopontin, and there's all kinds of research showing that if it's elevated, leads to a worse prognosis because it's a blood vessel growth factor. So you want to take osteopontin away from the cancer if it is elevated. And so you can measure that. People that have elevated levels of that, there's an herb called andrographis, which does numerous things. I've talked about it before. It affects other growth factors called like interleukin-6. But it also has been shown, at least in animal models, to reduce osteopontin. It's called andrographis. It's an Indian herb. It's been studied in people for arthritis and the common cold, but it has also been studied for cancer in animals, taking away blood vessels. And they've done some research on that. Another thing, sometimes what happens, so when you start blocking VEGF pathways and FGF pathways and these other pathways, cancer cells can release something called interleukin-8. And interleukin-8 is another growth factor that will still play a role in forming blood vessels, even when the cancer is not getting its VEGF or its FGF. And so there's numerous research studies done that you can measure interleukin-8 in the blood. And if it's elevated, it's associated with a worse prognosis for a whole variety of cancers, from breast cancer to prostate cancers to leukemias, lymphomas, all kinds of things. And so it's a simple thing that can be done at like a lab called LabCorp, and you can check that. And if it's elevated, there's actually a human study in women with breast cancer showing that 2 B vitamins, niacin, which is vitamin B3, niacin is B3, and riboflavin, which is vitamin B2, in combination with something called coenzyme Q10, which is like an antioxidant produced in our body, can reduce the production of interleukin-8 by cancer cells and inflammatory cells that are surrounding the cancer, and thereby taking that thing away. Curcumin might also lower interleukin-8, something called reishi, which is a mushroom. So there's a whole host of things that can be used, and the lab can guide a physician in helping to determine what is the best natural medicines or drugs to affect that. So, it's like you wouldn't really prioritize and put somebody on niacin and riboflavin if interleukin-8 is not high. But if FGF is elevated, well, then the boswellia might be the better choice. And it helps you narrow down a very complex array of nutritional supplements and drugs and things. It's just like checking for estrogen receptors in women with breast cancer. Those that have estrogen receptors, well, then they qualify for tamoxifen and aromatase inhibitors. You don't have that, you're not going to benefit from that. So you can use the lab to check all kinds of growth factors involved and formulate a plan. And this is what the research should be doing. Everybody's kind of looking at one drug, hoping that it's going to cure all the cancer and stuff like that. But as you can hear from this show and numerous other shows, cancer growth is very complex. Cancer changes, evolves all the time. And, I just not hopeful that one drug is going to be the answer. It's got to be a plan, and it's got to be a different plan for each person, individualized medicine, and using the lab to really help that. And not just a test off of a tumor sample, because you can't keep repeating that test. Cancer changes. By checking these things in the blood, maybe 1 week the interleukin-8 was normal, but 3 months down the road, it starts to rise as the cancer tries to become resistant to the current therapy. If you check the interleukin-8 and all these other growth factors, notice that they have changed compared to the baseline, then you can change the plan and stay ahead of that. And that's what I would like to see, some human studies where there's that kind of an approach, doing a set of baseline labs, constructing a treatment plan using drugs and natural things all together, individualized for the person, and then carrying it out, repeating labs, changing plans, and seeing outcomes and how that affects that. That is, I feel, going to be a lot more successful. Same thing with the immune system, checking the immune system, looking at the imbalances, correcting those imbalances using a variety of things, and then retesting, making sure that has been achieved. Okay, so that's one mechanism of resistance. Another mechanism is cancer cells will release bone marrow-derived cells. So there are cells that are precursors to blood vessels that come from the bone marrow, and cancer can release something called PDGF to induce the production of these bone marrow precursor cells to be released. But I got to take a break now, so when I come back, I'll get into that some more. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Okay, before the break, I was just starting to touch on another mechanism of how cancer cells start to make those blood vessels that they need. And if the existing materials that they have are being deprived from them in their vicinity, they will send out signals to the bone marrow, distant bone marrow cells, asking them, hey, I need some materials. Can you help me out? And the bone marrow will then start to dump out these, they call them progenitor cells, precursor cells that turn into blood vessel walls. So they start to be released by the bone marrow into the blood. The blood takes them to a nearby site where the cancer is because of these chemical signals being released, like pheromones or something being released by an animal to attract the opposite species there to bring it over there. So the cancer cells release these chemical attractants. The bone marrow cells are released, and they migrate to as close as they can get where there is a blood vessel, and then they start to form a connection between that existing blood vessel and the growing cancer cell mass. And what the main inducer of this process is something called HIF, hypoxia-inducible factor. When a cancer tumor starts to become too big, it's running out of oxygen. It needs some of the oxygen. You'll hear, cancer can grow without oxygen. Yes, it can. But in order to get bigger, it needs more oxygen. And the lack of oxygen induces the production of this thing called HIF. Hypoxia means low oxygen. And it causes the bone marrow to release these cells, causing the blood vessel to form, to connecting the cancer cell mass to existing blood vessels. Now it gets the oxygen it needs and all the nutrients that it needs as well. You can't measure HIF because it's being produced by the cancer cells themselves. At least to my knowledge, I'm not aware of that being a test that you can measure in the blood. But HIF, when it's released, there's something else that is produced in response to it called stromal cell-derived factor. And you can measure that in the blood. And there's numerous research studies showing that, for example, like brain tumors, when that's being inhibited by some Avastin or something like that, that the cancer will start to produce this SDF, stromal-derived factor, and that will elevate. So you measure that, and you work on things to knock that down, which I'll talk about. And then you can also measure the bone marrow precursor cells in the blood and see if those things are elevated. You don't want to see circulating endothelial cells or blood vessel cells in the blood. Okay, so you measure these things, and there are natural things that can help. And a lot of them are what's called bioflavonoids. Quercetin is a bioflavonoid found in apples and onions that have been studied in animals in the Cancer Chemotherapy Pharmacology Journal 2010. They treated animals with breast cancer, either quercetin by itself or quercetin or just a control group, and measured this HIF, this hypoxia-inducible factor, and it reduced it by 50% and also then decreased blood vessels and tumor growth. There's something called Indian gooseberry. It's a tree found in India, and the fruit of the tree and the stems of that attach the fruit to the tree have been shown to contain numerous compounds that include quercetin and other things called ellagic or elagitannins. And it has been also shown given to animals. They give animals ovarian cancer, and they gave this amla or Indian gooseberry, and they give it orally just for 18 days. And it wasn't much, about a human equivalent of 1 gram. And after 18 days, they measured HIF production by the tumors, the ovarian cancer tumors, and found out that it was reduced by 75% of the cancer cells had a reduced level of that HIF, and it led to reduction of blood vessel by 50%. And the tumors hardly grew at all in the group given AMLA, but they increased by 200-fold in the group after 18 days, not just given the control, nothing, no AMLA. So there's a big difference there. More research, again, needs to be done, but it's this fruit from a tree and very well tolerated. Doesn't cause blood clotting or bleeding or any rashes like some of the approved drugs right now. And it affects this HIF system, which there aren't really any drugs that affect it right now to my knowledge. Another thing that contains something that is found in AMLA called elagitannins is pomegranate. Pomegranate and AMLA contain these compounds called elagitannins, ELLAGITANNIS. And they're found in pomegranate. And I've already talked a lot about pomegranate with prostate cancer. Well, they found that pomegranate, the elagitannins in the pomegranate, if they use the skins of the pomegranate fruit and that jelly-like substance that surrounds the seed, that it can also reduce this HIF and inhibit blood vessels and affect even VEGF too. So that's another thing that needs to be studied. Then there are some foods that have been shown in test tubes to affect it, and it can't hurt to eat them. Those cruciferous vegetables might affect HIF, the Brussels sprouts, the watercress, the broccoli sprouts. So that's the food family that seems to have some profound anti-cancer effects. If you're going to eat any vegetable, you want to eat something in the cruciferous vegetable family, especially Brussels sprouts and broccoli sprouts and kale and collard greens, and watercress is also a really good thing. And it might affect these things as well. But you can measure SDF, the downstream product of HIF, and use that as a guide. If somebody has an elevated level of that, then you have AMLA, you have pomegranate extracts, quercetin, numerous natural things that might affect that, reduce that, take that necessary growth factor away, so that bone marrow cannot release these precursor cells. A third mechanism of action is if the blood vessels are being disrupted Like I mentioned, the roads are getting all full of potholes and beat up by the blood vessel inhibitor drugs being used, or even natural things. Another thing that cancer cells will do is try to reinforce the blood vessels that are present by adding these things called pericytes. They're supportive cells. So just like, okay, you got a bunch of potholes in the road, you start to pave it, you start to repair it, so that the deliveries can still be made to the growing family of cells. And so there's two major growth factors that are involved in reinforcing the blood vessels, the pericytes, and one's called PDGF, platelet-derived growth factor, and another is called angiopoietin. And they can be measured also in the blood, and you can use natural things to affect that. Well, there's been a study done, and this was done in people with pancreatic cancer, HPB Oxford Journal in 2013 in the UK, where they put patients with pancreatic cancer on chemotherapy by itself or chemotherapy plus intravenous omega-3 fatty acids. And they measured some of these growth factors like PDGF, and they even measured FGF. And they showed that those things were reduced in the fish oil group, and that led to improved overall survival. But they, just affected those things. And fish oil is not going to affect every single growth factor, but it is a start. They used intravenous because it gets in the system quicker. But if somebody switches their diet over to eating lots of omega-3 fatty acids, over time, these cancer cells will start to be lined with omega-3 fatty acids, and they won't be able to release a lot of these growth factors that they need. Another thing that's been studied, there's this Dr. Matthias Roth, who used to work with another scientist, Linus Pauling, very famous scientist. And Linus Pauling had a theory that something called lysine might be useful in cancer. That basically cancer cells, there's in order to release a lot of these growth factors, they start to break down their surrounding, because it's kind of like they have little pockets of these growth factors in their vicinity, kind of stored up, like squirrels are storing their acorns or something. And then when they are running out of food, they go into their stores. So a lot of these growth factors are found in what's called the extracellular matrix that surrounds the cancer. And so cancer cells will release these things called MMPs, enzymes, to break down this extracellular matrix, releasing a lot of the growth factors. And it turns out that there's this enzyme called plasminogen that is a necessary enzyme that cancer cells use to break down their extracellular matrix. And it has a binding site for this amino acid called lysine. And there happens to be a drug that inhibits or affects the clotting process in the body called tranexamic acid. That is a analog, a copy of like lysine, and it has been shown to inhibit this plasmin thing and stop bleeding in somebody. But lysine is something that Matthias Roth and Linus Pauling have studied. And so there's numerous studies, but there's one in Oncology Reports 2005 where they combine lysine with a few other things that affect these MMPs, these things that break down the extracellular matrix, proline, and even vitamin C, and showing that when that was given orally to animals with cancer, that the cancer cells were not able to produce as much PDGF, platelet-derived growth factor, and it was also shown to reduce the MMPs, another blood vessel growth factor that leads to the breakdown of the extracellular matrix. And Matthias Roth has also included green tea in there, finding that green tea combined with the lysine, proline, vitamin C might work better because green tea also inhibits these MMPs that release the things like the PDGF from the storage around the cancer. Something that needs, human studies to find out some more. Angiopoietin is another thing that is needed to reinforce the cancer, and the green tea has been also shown to affect that. So numerous things on that aspect. And you can measure PDGF. You can measure all kinds of the MMPs and make sure that they're not elevated. You can measure MMP9. That's available at LabCorp. And use that as a guide to make sure that the green tea and this lysine and things are affecting that. The fourth mechanism of action is when the cancer cells do not get their nutrients that they need from forming new blood vessels, they start to migrate out along existing blood vessels. And this is a major thing that happens in brain tumors, for example. And then ovarian cancer, you'll see the cancer starting to spread out along the lining of the abdomen. Or then there's cancers that spread out along the lining of the lungs, for example. And so instead of a mass of a tumor, there's more like a sheet or a caking, a thickening that happens in that cell membrane. They call it like omentum caking in the abdomen, where it lines that, because there's all kinds of blood vessels there, and the cancer just spreads out and accumulates that way. And the thing that is needed to do this, they have found, is something called connexin. So you can think of it as like it's with an X, like connecting or helping it spread out. And so there's numerous things that affect connexin. One thing I've talked about before is apigenin. Apigenin is something found in parsley, and it's found in celery and chamomile tea and stuff. But it has been shown to inhibit these connexins so that the cancer can't spread out and invade along blood vessel walls. It's very well tolerated. Only animal studies so far, but given it orally in pretty small dosages, something that needs to be looked in further. And you can even measure things that cancer cells use to spread out. D-dimer is a product, a breakdown product of something called fibrin. And if you see elevated levels of D-dimer in the blood, it can indicate that the cancer is trying to spread out and go places. And monitoring that as a lab test, that can help determine if you're getting somewhere. So I'm running out of time. And today was the 13th show. I've covered a lot of material over the last 13 weeks. I hope you've found it helpful. And if you didn't get a chance to listen, the first 4 shows were on enhancing the effectiveness of chemotherapy with natural medicines. And then 4 shows after that were on immune system imbalances and natural medicines that can help correct immune system imbalances. And then I talked about resistant mechanisms to hormonal therapies used for prostate and breast cancer. And now I'm talking about blood vessels. So, and then I've talked about the role of the lab, so you can get a better understanding of how lab tests can be used to determine if you are forming resistant mechanisms to chemotherapy or hormonal therapies, and natural medicines that might stop some of those resistant mechanisms, and using the lab to guide you that you're on the right path instead of waiting for the CAT scan to show either shrinkage or growth. And then you can also use the lab to measure immune imbalances and using natural medicines to correct that. But a lot of the studies I've quoted so far have been in animals. There are some human studies, but certainly not to the degree of the drug industry. But these natural medicines can touch on things that so far they don't have drugs for. A lot of them are very well tolerated. I hope anybody listening that has some money or is involved in any kind of fundraising will start, doing some fundraising for natural medicines. Maybe the cure is out there for cancer, but it might not lie in drugs solely. There's a nice connection between natural medicines and drugs, using them together to help people, but using the lab to individualize the medicine to the person, and using the lab to help keep that treatment plan evolving just as cancer evolves, to stay ahead of these more aggressive and resistant cancer cells. So I hope you enjoyed the show. This is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.